Good morning. My name is Dr. Modupe Tunde-Byass, an obstetrician and gynecologist working in the North York area. I'm also one of the co-founders of Women Health Education Made Simple. Today, I'm going to be talking on the safety of COVID-19 vaccine in pregnancy and during breastfeeding. Most pregnant women would have a mild to moderate disease. However, there are a small number of women who may develop serious illness. The risk of early labor and stillborn and preeclampsia is increased in women who have contracted COVID-19 infection. They're usually mild. You could have pain over the injection sites, muscle pains, sometimes fever. Serious side effects, it's rare. COVID-19 vaccine are safe and 94 to 95% effective in preventing COVID-19 infection. It also reduces the risk of dying from the disease. And pregnant women traditionally receive vaccines during the pregnancy. We do administer diphtheria, tetanus, and pertussis, and flu vaccine during the pregnancy, and they're safe. Although they were both excluded from the phase 2 and 3 trials of the COVID-19 development, we know that there are new studies being performed by Pfizer, which is showing us a very favorable result that the COVID-19 vaccine is actually safe and the immunity can be passed on to the baby. You may want to decide whether you continue receiving the second dose of the vaccine or you want to stop. The other question is, what happens if you're planning a pregnancy? According to the Society of Obstetricians and Gynecologists of Canada, the advice is for you to receive the 2 doses prior to getting pregnant. You may choose not to receive the vaccine and continue to follow the public health guidelines. Keep your mask on, avoid overcrowded area, observe the social distancing, and also keep washing your hands. Please be reassured that even people with severe allergies can receive COVID-19 vaccine. This vaccine is made of protein. It does not contain dye, no additives, no food materials, no eggs, so it is considered safe. Yes, I have received it, and I had mild pain over the injection site, and I was observed at the vaccination center for 15 minutes before I left. You can decide to get this vaccine as soon as possible, or you wait until there are additional information about the safety of the vaccines in pregnancy and during breastfeeding. Or you could wait until after your pregnancy and or breastfeeding. That is my work and also the work of other healthcare providers. We're there and we're available to guide you through the principles of receiving the COVID-19 vaccine. One of the things we want to do is to assess your risk, whether you are high or low risk. Your risk of getting COVID-19 infection is higher if you work outside your home, or you're an essential worker, or you are also a healthcare provider. Your risk of developing a severe illness is also increased by some of pre-existing conditions that you may have. For example, if you're overweight, if you have medical conditions like asthma, kidney disease, autoimmune disease, liver problems, diabetes, or even hypertension. Thank you so much for listening to the series on the safety of COVID-19 in pregnancy and during breastfeeding. Please watch out for more series coming out from the Women's Health Education Made Simple. Thank you so much and have a great day.